Hi, I'm Dr. Lewis Clark, and I want to thank you for taking time to watch my video on why isn't my brain working. If you're like many of our patients, okay, maybe you've been noticing that thoughts aren't coming quite as quick as they used to, or maybe short-term memory is beginning to slip, or your focus, or you just can't process as fast as you once did. Well, maybe today you'll find some of the solutions of that. So first of all, let me tell you a little bit about my training and my degrees. I'm first of all a board certified chiropractor in the state of Texas. I'm also board certified in integrative medicine. And also I'm a certified gluten practitioner and a certified wellness practitioner. So with over 23 years of experience, there's a lot that I've learned from clinical experience and also from training with a lot of the top doctors around the world. And so we're going to talk about one of those doctors in just a moment. But before we do, I just want to cover some of the things that we're going to talk about today. Number one, we're going to talk about how the brain works. Number two, we're going to talk about the underlying causes of brain decline. And then number three, we're going to talk about how to maximize your brain's health. And obviously that's what we all want, is a good, healthy, functioning brain. And so this is one of the doctors that I've trained with, and I highly recommend his book, Why Isn't My Brain Working? His name is Dr. Tatis Karazian. And Dr. Tatis has taught me a lot, not only about the brain, but also about thyroid and other chronic illnesses that we deal with in our office. So this is a good read. It's written for patients, and so you'll be able to understand a little bit about how the brain works, and it'll help you get an understanding not only of the things that we do in our office and why we do them, but also of what may be going wrong with your brain. So as we get started, let's talk about this. What is the difference between a hard lesion and a soft lesion? And this will help you also understand the difference between a medical neurologist and a functional neurologist, okay? So a hard lesion is something that's caused damage in the brain, where cells have literally been destroyed. It could be like an aneurysm, it could be a stroke, it could be a tumor, it could be some type of space-occupying lesion, or even a severe closed head trauma where there's actually loss of brain tissue. That's a hard lesion, okay? Those are going to be diagnosed most of the time by imaging. You're going to go in and get an MRI, and it's going to show that hey, there's areas where there's not any blood, or there's areas where there's a bleed, or there's a tumor inside there, or something like that. And so then there's what's called soft lesions. Soft lesions are not going to be typically diagnosed by technology like MRIs and other type of imaging. The reason is because the cells are still there, but they're not working properly. This is a functional problem. And the great news about that is that it can be restored. The cells can be brought back up in many cases. And even where there is some cell loss, you can still improve the function of the cells that are there through what's called neuroplasticity. We'll talk a little bit about that in another time, but neuroplasticity basically means the ability for the cells to communicate with each other. And there's a lot of research out there now on neuroplasticity, and we're learning so much about how the brain rewires itself and how it changes itself. And so that's good news. And so a lot of people have asked me, you know, why when I went to the neurologist, do they not do the things that you do? Well, the reason is they're looking at different types of lesions and for different types of lesions. And so we're going to do different types of tests, and then of course we're going to do different types of treatment. But the good news about that is many times you've been to the doctor and you've had all the scans and everything, and you still don't have a reason for why you're not feeling and your brain's not working as good as it should. And all you've left with is a prescription for a drug. The good news is maybe you've got a soft lesion and there is something that can be done. It just hasn't been detected yet. So let's get into a little bit more about the way the brain works here. And I want to start with talking about some of the symptoms that occur because of soft lesions. And this can include everything from depression and anxiety to ADD and to short-term memory loss to even things like chronic headaches and brain fog and even things like OCD are related to soft lesions, and many, many more, obviously. So we're going to talk about some of those more specifically in just a few moments. But before we do, I want to talk more about how are we going to, or how prevalent, should I say, then, are soft lesions in our society today? Well, take a look at the stats. 1 in 8 seniors develop Alzheimer's. Wow, that's amazing in itself. 1 in 8 children develop some type of autistic spectrum disorder or some type of learning disability. Dementia, 24 million people suffering with dementia. And I got to say also, I've got to include movement disorders and balance issues, and that being the #1 cause of accidental deaths. And of course, if you look at the list of most commonly prescribed drugs, always on the top 10 are going to be many of the antidepressant, anti-anxiety type drugs. So let's talk about now the things that a healthy brain needs. Okay, this is critical. There's basically, you've got to have fuel for your brain, and fuel is going to come in the form of glucose and oxygen. And then also you're going to need chemical messengers, which are called neurotransmitters. Now, neurotransmitters allow the one nerve or axon of the nerve to talk to another. So you've got to have something that makes that synapse happen, and that's where a neurotransmitter comes in. You're also going to need, of course, proper activation. Cells must be stimulated. A nerve cell that does not get stimulated slows down and eventually dies. And then, of course, you need an inflammation-free environment. Inflammation is like a blowtorch to your brain. It causes cells to literally die. And we'll talk a lot more about that in a second. But here's the thing. If you don't have these things going on, medications will not work long term. You may temporarily improve in your symptoms, but long term you're going to end up the same or even worse, because you don't have the essential things that your brain needs in order to operate properly. So now we know what the brain needs. Now let's talk about how the brain actually works, how it fires, how the brain works together, because all the signals that enter into your brain come in from the cerebellum. The cerebellum is the area of right at the base of your skull, okay? Signals are going to enter in there, then they're going to fire across to the opposite cortex. So the right cerebellum will fire into the left brain or left cortex. Now the left cortex, particularly the frontal lobe, is then going to fire into the medulla or the lower brainstem. This is in order to inhibit the midbrain, or what's called the mesencephalon, okay? And the reason for that is the mesencephalon is your sympathetic system. Now, if you don't have normal firing, if you don't get signals going into the cerebellum, then the frontal lobe particularly, but the entire cortex receives less signals and therefore cannot stimulate the lower brainstem, the medulla, to block your sympathetics, and you end up with an overfiring sympathetic system. You also end up with an imbalance in your brain, and your brain is created and designed to be balanced. So it's very important that we get proper balance. Now, what are some of the symptoms of an overfiring mesencephalon or an overfiring midbrain? Well, take a look. Migraine headaches because of the effect of blood flow. Light sensitivity because of the dilation of the pupil, because of the sympathetic system firing and overfiring. Insomnia and fatigue, so you don't sleep well. You also don't have good energy during the day. You decrease or increase risk of urinary tract infections because your bladder doesn't empty properly. Fibromyalgia, you're going to have more pain, chronic pain because of this overfiring mesencephalon. Constipation and diarrhea, heart racing. These are all different symptoms that are typically just treated with drugs, and the underlying cause is never addressed. So we're going to talk to you about how we look at this, and one of the ways we know if you have an overfiring sympathetic system is by doing what's called a QEEG. This is a quantitative EEG. And what happens in this is, you've heard of EEGs before, but with this special type of EEG, you actually measure the brain waves in different areas of the brain. So you can tell if your frontal lobes are working right. You can tell if your temporal lobe, your occipital lobe, your parietal lobe, or even if your prefrontal motor cortex is working properly. So here's what we have. So you have 4 different brain waves. You have the slowest brain wave, which is delta, the fastest brain wave, which is beta, and these are all responsible for different things. So take someone, for instance, that has a problem with ADD. They have a problem with focus or attention. Typically, they're going to have an overfiring theta, and they're going to have an underfiring beta, especially in the frontal lobe. When you see this pattern, you know that this is what's causing their inability to focus, to pay attention, and a lot of times to learn. So this is a valuable tool in assessing what's going on with your actual brain. That's not the only tool. We also, of course, do a functional neurologic exam, which we'll talk about. The other thing that we're going to have to evaluate with your brain is obviously your metabolism. And so what I mean by that is your ability to take food, to eat food, and to produce energy. Because, guess what? If you decrease energy, 30% of all the energy that your body produces goes to one organ. I wonder if by now you can guess which organ that is. It's your brain. Your brain is consuming 30% of all the glucose and oxygen that your body can produce. Okay, so we've got to get our metabolism working right, okay, in order to have a healthy, functioning brain. Now, let's look at just the different areas of the brain quickly. We won't spend a lot of time on this, but it's important that you know that there are certain areas of the brain responsible for certain activities. And so, for instance, like the frontal lobe. The frontal lobe is basically who you are. It is your personality. It is your expression of life. It's where your decision making comes from. It's where even movements, like for me to move my arms today, is also coming from the frontal lobe. So it has to do with social behavior, has to do with impulse control. So someone that does socially inappropriate things or has outbursts, this is a person that has trouble with their frontal lobe. Someone that has movement disorders where they have tremors is someone that has problems with their frontal lobe, in particular the basal ganglia part of the frontal lobe. So this is a common place where depression occurs. If someone has depression, basically they have a slowing down of the frontal lobe. And so you're going to see a lot of the symptoms, most commonly depression. Anxiety is exactly the opposite. Frontal lobe overfiring. Their thoughts are running away with them. Slow movements, very common. Mental sluggishness, laziness, poor impulse control. We've already talked about that. You're going to also see poor handwriting because of the muscle control to do that, but that can also be affected by the cerebellum, and poor learning, especially in math and language. So let's talk about the temporal lobe. The temporal lobe is located here on the side. You're going to think of things like memory. You're going to think of hearing, of course, but sleep also because of the effect of the hypothalamus and the pituitary. And then you're going to think of symptoms like dementia there. You're going to think of things like insomnia, ringing in the ears, or tinnitus, or hearing loss. And then we have the parietal lobe. So parietal lobe is a big lobe right up here. Anything that you feel or sense or anything that you tell where it's located at happens in the parietal lobe. Okay, so it has a lot to do with pain. If you've got a lot of pain, you can have problems with the parietal lobe. And so symptoms of degeneration or decreased function of the parietal lobe are going to involve things like can't recognize objects, get lost easy, you come out of the store, you can't remember where you parked your car, numbness, tingling, because again, it's going to control all feeling. You're going to misjudge where things are. You're going to be injury prone and certainly going to be unstable. You're going to have bad balance. That can also be affected again by other things as well. So let's look at the back part, which is called the occipital lobe. Okay, the occipital lobe is going to be a lot to do with vision. So your interpretation of what's going on visually is going to come from there. So obviously if you have degeneration of that, you can have vision problems. You can even have things like hallucinations and all kinds of different things go on that are related to vision from the occipital lobe, which by the way is a common area to be injured from trauma. Because a lot of times when we fall back, or if we hit our head in an accident, we hit the back glass or something like that, that can cause damage. So now let's talk about the little brain. It's called the cerebellum. Cerebellum is located down below the occipital lobe in the back, and remember, all the signals go into the cerebellum. It's all unconscious stuff, but it is the most neuron dense part of the entire brain. It's also the most metabolically demanding part of the entire brain. So again, if your energy level goes down, you're going to have cerebellum problems. If you've got traumas where you get inflammation, you're going to have cerebellum problems. What kind of cerebellum, what will cerebellum affect? Well, it's going to affect coordination, it's going to affect balance, it's going to affect accuracy. So you're going to have things like where you misjudge where things are. You may have poor coordination. You may also have eye movements affected. Eye movements are also related to cerebellum. So vertigo is a big problem. Blurry vision, nausea, poor balance, we talked about. Subtle shakes at the end. The difference is if it's a frontal lobe, it'll shake when you're resting. Cerebellum will shake, like if I go to reach for something, when I get close to it, it'll start to shake there. That's the difference, how you can tell which one it is. And you end up with a lot of neck and back problems because the cerebellum controls the posture and alignment and strength and movement of your spine. Let's talk about the brainstem. Three main parts of the brain. The cortex we covered, the cerebellum we just talked about, and the last part is the brainstem. This is your autonomic nervous system section. There are three different levels of it. There's the midbrain, we talked about overfiring earlier. The lower, which is the medulla, which inhibits the midbrain, and in between is the pons. This is going to control all organs, blood vessels, and glands. So it's all autonomic. It means it's all automatic. It's going to happen without you thinking about it. It's going to have two sides to it. It's going to have a parasympathetic and a sympathetic. And here's the way to remember it. You already probably heard sympathetic means fight or flight. Well, parasympathetic means rest and digest. So if you're having trouble resting, or if you're having trouble digesting, this system's not doing its job. And maybe it's because this system's overfiring. Very important that we understand that both of these divisions cannot be dominant at the same time. One is either working more than the other all the time. Okay, so if you got a good parasympathetic function right now, you're resting and digesting well. And that's good most of the time. If you're in an emergency situation or working out, then you need the good sympathetic control. Just remember though, most of the time, 90% of the time, you want to be in the parasympathetic mode. When the sympathetics begin to overfire, it's because of some type of stress, and not just emotional stress. There's a lot of other types of stress, physical stress and chemical stress as well. So, signs of overfiring sympathetic system: high blood pressure. Man, well, if you're in an emergency, you need high blood pressure. That's an intelligent thing to happen. Poor digestion. Well, we've already said you can't rest and digest. You're going to have sleep problems. You're going to have headaches. You're going to have chronic pain, insomnia, fatigue. Hormones are going to be out of balance because that's parasympathetic. You have cold hands, cold feet, frequent urination or incontinence, erectile dysfunction, and low libido. Those are the signs of an overfiring sympathetic system. So, I'm going to give you the top 11 things here that can lead to the brain misfiring and beginning to dysfunction and ultimately end up in brain degeneration. So, number one is blood sugar imbalances. This is a pandemic problem in America. Number two is stress. There are different types of stress, not just emotional. 3 is poor circulation. If you don't get oxygen, cells can't work in your brain. Food sensitivities. We'll talk more about that. Poor gut function, inflammation, poor neurotransmitters, hormone imbalances, poor essential fatty acid, toxins, and lack of activity. You got to have stimulation to your brain. Now I'm going to talk about just a few of these, not all of these today. We don't have time for that, but I'm going to talk to you about some of the most common of the top 11. Number one, we're going to talk about stress. Stress is more, as I said, than emotional. your biggest stressor that you're going to have is probably your ability to regulate blood sugar. If you can't regulate your blood sugar, it's also going to result in stress, okay? But stress atrophies the brain, it causes inflammation, and it breaks down the blood barrier. These are different types of stress. Poor diet is a tremendous stress to your body. Food sensitivities we've already talked about. Alcohol, smoking, caffeine, and other toxins, infections, anemias, autoimmunities, poor digestion, and pain. These are all stress to your body of different types. Now, stress is going to cause an increase of a hormone called cortisol, which comes from your adrenal glands. Cortisol is going to have a devastating effect upon your hippocampus area of your brain, which is where your short-term memory is contained. So people that are highly stressed begin to lose their short-term memory. Literally, that area burns out because there's so much cortisol in that area. The other thing, though, because closely related to that is also your pituitary, you start to have hormonal problems like thyroid or weight problems associated with stress and damage to that area of the brain. Now, let's talk about what happens with food sensitivities. If you eat foods that your body's sensitive to, and today we have all kind of genetically modified foods and all kinds of other things out there, food that's been changed, especially things that are reactive like gluten and dairy and soy and all these different things. So your immune system begins to attack it. It senses it as foreign. And then cytokines, which are chemical messengers in your immune system, are released into your bloodstream because of what happened in your gut, but they go from your gut to your brain. So you have a communication between the two that results in inflammation of the brain. When this happens, what happens with inflammation, remember? Decreased function and ultimately cell death. You got to get tested for these food sensitivities. These are the three big ones right here, but there can be others. So along with that, we talk about gut and brain connection. Let's talk about poor gut function. Poor gut function, poor brain function. It's that simple. There's no other option there, okay? So most of the neurodegenerative people that I see in my office have bad guts. They have poor digestion and have had for years. They have chronic constipation, or they have bouts of diarrhea and constipation, or they constantly have belching or bloating or something else going on where they just don't digest well. That's a bad sign. We talked about all the different things except for this. Leaky gut syndrome is where your gut has now been damaged and it's allowing things out of the digestive tract into the bloodstream, which is going to promote more inflammation, more immune attack, and more brain damage. Dysbiosis is where you have actually too much bad bacteria, not enough good bacteria. And then, of course, gut infections. A common problem, by the way. Low-grade chronic gut infections. Unbelievably common. Things like H. pylori infections, things like parasite infestations, things like the overgrowth of small bacteria, intestinal bacteria, things like that. So then we get brain inflammation. We've already said kind of how dangerous this is. And by the way, it doesn't just work where the gut's inflamed and the brain's inflamed, but it also works where the brain's inflamed, maybe from a head trauma or something else, and then the gut's inflamed. So it goes either way. Now, these are some of the common causes. Diabetes, probably didn't think about that. That's the number one reason. Poor blood sugar regulation causes inflammation. High carb diets, poor circulation, cortisol levels, homocysteine levels, which are important, and of course, toxins like alcohol. So let's talk about the neurotransmitters for just a second. Neurotransmitters, I've already said, are chemical messengers that take the signal from one neuron to another. Okay? You've got to have good metabolic function in order to produce neurotransmitters. Okay? So there are different types of neurotransmitters. Acetylcholine, you think about that, the main thing, well, one of the main things is memory. The other main thing is balance. I'll tell you this, just as a warning. I don't prescribe drugs, I don't make recommendations on drugs, but I do know that one of the most dangerous things to your memory is to be taking drugs to affect your balance. In other words, if you have an issue with dizziness or vertigo and you've prescribed a drug long term for that, it will decrease your acetylcholine, because the acetylcholine also controls your vestibular system, which is your balance system. Serotonin, you know about that. For depression, that's very common. It's your ability to enjoy and life and have satisfaction and to sleep. Dopamine has to do with motivation, has to do with social interaction and self-worth. GABA is your number one calming neurotransmitter. It's your inhibitory transmitter, stops your brain from firing. So people that can't sleep usually have a deficiency. People with anxiety normally have a deficiency. Balance is the key. You've got to have good balance in your neurotransmitters. That's the bottom line. So what can cause neurotransmitter imbalances? Man, you name it. Medications can do it. Poor gut function, especially gut probiotics, can do it. B vitamin deficiencies, especially if you have genetic issues like MTHFR or other genetic mutations, or if you just got a poor diet, or if you are a vegan, sometimes you don't get enough B vitamins. Anemias, everything that we've talked about can lead to this. I want you to remember this. Let's stop at this point because we talked about the brain for a number of minutes. The brain cannot be separated from the body, and the body cannot be separated from the brain. If you have a poor functioning brain, you're going to have an unhealthy body, and vice versa. So don't try to separate the two. They always go together. So to summarize, your brain needs stimulation. It needs activation, and the biggest activation comes from gravity. This means you need to move. You need to move your joints and let gravity affect those. You must have a healthy functioning spine in order to get a good functioning brain. Number two is touch. So literally, interaction with others is highly beneficial to your brain, obviously. And so also, in our office, we're going to use types of therapy that are going to increase stimulation to the brain. We use things like eye movements, we use vibration, we use movements and exercise, we use balance exercise, gaze stabilization, breathing exercises, we use manipulation or adjustments, we use unilateral stimulation a lot because one side of the brain is typically weak compared to the other, and they must come back into balance. There are more advanced things that we do as well. So just kind of to understand this, what does a healthy brain need to thrive? Well, it needs good glucose, oxygen, neurotransmitters, proper activation, and remember, an inflammation-free environment. So if anything I've said today, first of all, has made any sense at all, and you are worried or concerned about the function of your brain, the next step that you need to do is you need to get a full and complete neurologic workup. And let me explain to you what that means. That means, number one, a full functional neurologic exam. Not just a questionnaire or screening, not just a MRI, because you've already said a lot of times that comes back negative, doesn't show the problem. You need a full functional neurologic exam, which includes neurotransmitter assessment forms, neurologic assessment forms. It means doing a full functional examination. It means also doing a QEEG, a quantitative EEG of the brain to see how the brain waves are working. Now, in addition to that, we'll also need to do a metabolic workup, which includes not only metabolic assessment form and a complete history, but also maybe we need to do a functional blood analysis. Look at some blood work that you've had done, or have you do some blood work, and look at it from a functional standpoint, not just a disease standpoint. And we'll talk more about that on another video. But so here's what we do in our office. If you're interested in becoming a patient in our office, this is what you need to do. If you want to have your brain evaluated, it's going to take 2 days. Number one, first day is to do all the evaluation, including everything we've talked about. Number two, after I've had time to analyze all those different things, then we'll sit down and do a second day with you and your spouse or significant other, somebody that's involved in your life, that knows what's going on with you, that's going to help you to make decisions on what you need to do to improve your health. And that's going to involve about a 45-minute office that's explaining what we find and what we recommend at that point, if we're certain that we can help. And there's, first of all, I can't help everybody. The people that I know I can help, okay, there are two types of patients I will not accept. Number one is the ones that I don't feel I can help. Number two are the ones that will not help themselves. You must be willing to make lifestyle changes. One of the signs of insanity is if you keep on doing what you've been doing, you're going to keep on getting what you've been getting. So I hope this has been helpful to you. If you'd like to make an appointment, you can contact our office at clarkchiropractic.net, or you can also call us on the phone at 281-354-8330. If you'd like more information or some other videos on some of these other details we've talked about, I'd be glad to make those available to you. If you think you're ready to make an appointment, you want to come in, here's some things that you need to know. You're going to have shorts and t-shirt when you come in for the exam. You're going to have all your initial paperwork filled out completely. And remember, your spouse must be willing to attend to find out what is going on with your health. If you decide to do that, I'm going to tell you right now, I only accept 5 new brain-based problem patients per month because of the intensity of the amount of work that it takes to rehab and to get a person's brain working again. Initially, or usually, I charge $450 for the initial 2 visits. If you see this video and you call my office and tell them I saw Dr. Clark's video, then I will give you the first 2 visits for $75. If I feel I cannot help you, I will refund your $75. Okay, but let me say this also. If you're contacting me and you've already been diagnosed with Parkinson's, you've already been diagnosed with dementia, or you've already been diagnosed with Alzheimer's, it does not mean you cannot improve. But just remember, there's already some permanent damage done. But if you want to know if we can help, I will tell you. And if I cannot, I will do my best to refer you to someone that might be able to improve your quality of life, because that's our goal here. And so, thank you for your time again. God bless you, and have a great day.